Welcome to this week's edition of Endocrinology Updates, covering the latest breakthroughs, brought to you by LucidQuest. GLP-1 receptor agonists have shown superior cardiovascular protection compared to Metformin in women with PCOS. A large-scale real-world study across 60 institutions over 3 years revealed a 17% reduction in arrhythmia risk and a 22% decrease in thrombotic disorders among GLP-1 receptor agonist users. The FDA has officially approved Susvimo as the first continuous delivery treatment for diabetic retinopathy. With only one refill every 9 months, over 80% of patients in the Pavilion trial achieved at least a 2-step improvement in diabetic retinopathy severity after 1 year. Bromocriptine is emerging as a viable option for managing type 2 diabetes. A meta-analysis of 18 randomized controlled trials revealed consistent reductions in HbA1c and fasting glucose. While heterogeneity was high, the data support its role for patients who are intolerant to conventional therapies. In orthopedics, advanced imaging studies show that a high-riding patella, known as patellar alta, is frequently observed in ACL-reconstructed knees. This anatomical shift is associated with altered contact mechanics, potentially contributing to the development of patellofemoral osteoarthritis. On average, the patellar tendon was found to be 9 millimeters longer in both ACL-reconstructed and contralateral knees. Orforglipron, an oral GLP-1 receptor agonist, is demonstrating strong efficacy in type 2 diabetes management. This new therapy offers the dual benefits of blood sugar control and weight loss without the need for injections. A redesign of gestational diabetes care in the Netherlands has led to significant improvements. The initiative resulted in an 85% reduction in specialist referrals, a 47% drop in insulin therapy initiation, and nearly 10% lower costs, all while maintaining stable clinical outcomes and increasing patient satisfaction. The Body Shape Index, or ABSI, is now linked to osteoporosis risk. Data show that individuals in the highest ABSI quartile had almost double the risk compared to those in the lowest. This nonlinear association suggests that ABSI could be a valuable early screening metric for bone health assessment. Insulin resistance, particularly measured via triglyceride glucose-based indices, is now associated with an increased risk of knee osteoarthritis. In contrast, homeostatic model assessment for insulin resistance did not show a significant correlation. These findings underscore the metabolic dimensions of osteoarthritis, especially in patients with type 2 diabetes. And finally, machine learning models are identifying key risk factors for hypoglycemia in patients with type 2 diabetes. The most influential predictors include insulin therapy, longer duration of diabetes, and decreased kidney function. SHAP analysis enhanced the interpretability of these models. Notably, 32% of patients reported at least one hypoglycemic episode. Stay ahead in endocrinology research. Like, share, and subscribe for weekly updates. Visit lqventures.com or email us at info@lqventures.com for expert healthcare consulting. See you next time.